I am going to discuss with you the epidemiology of invasive fungal infections. You know that in case of epidemiology, because of the lack of awareness of fungal disease, and there are very few mycology laboratories in the country, we don't know exactly what is the epidemiology. And the problem is, in case of the patients don't say that I have fungal infections, and there is no specific clinical symptoms and signs. Even the radiology does not help in most of the situation. If we look into the capability wise, at present the science, the way it had progressed, even the diagnostic capability of the best laboratory is not more than 50%. So majority of the cases, if you have gone for post-mortem, you possibly can know that the patient ultimately died because of fungal infection. Now, beyond all this, there are also problems that our susceptible host pool is increasing. There are many new risk factors which are emerging, and also the spectrum of fungi causing infection has also widened. So what we tried to estimate from leading international fungal education, that over 300 million people affected by serious fungal infection, and of which 25 million have life-threatening or largely debilitating disease. And when we compare the deaths because of fungal disease, it is comparable to the tuberculosis and even more than malaria. But you all know how much attention to the tuberculosis and malaria are. There is very little attention in case of fungal disease. You know, this is again the world picture which we tried to project about the main fungal disease: invasive candidiasis, aspergillosis, mucormycosis, pneumocystis and cryptococcosis. I like to draw your attention to the last column. You see the mortality is close to 50% and even more than 50% that has been seen. And when you come to India, the picture becomes more grave. The reason is, if you see of invasive candidiasis, it is around 10 to 20 times than the whole world. Means I am saying in the whole world, any of the countries when we try to look into, the incidence is much higher in case of India, whether it is invasive candidiasis or mucormycosis. Why it is happening in Indian scenario so high in number? First thing, we are in tropical environment where fungi easily thrive, and we have around 1.25 billion population, so too many patients come to the hospital. You look into our hospital emergency or hospital OPD, this shows that too many patients compared to the bed strength which are coming to this hospital. So what happens because of that? There is compromise in case of healthcare, because in many studies what we have seen, 46 to 80% of the healthcare